Hello, this is Dodie from Deliberate Aging. Welcome to my podcast. Today's episode is all about something that becomes more important with every birthday we celebrate: keeping our balance, protecting our bones, and most importantly, preventing falls. Let's face it, aging is a gift, but let's also be real. Our bodies don't always move like they used to. Things creak a little more, we might not feel as quick on our feet, and sometimes a simple misstep can turn into a serious situation. So here's a stat that might catch your attention. 1 in 4 adults age 65 and older fall each year. That's according to the CDC, the Centers for Disease Control and Prevention, in 2020. And did you know that falling once doubles your chance of falling again? And of those falls, about 20% result in serious injuries, things like broken bones or head trauma. And here's the kicker. After a fall, many older adults become afraid of falling again, and that fear leads to less movement, which leads to weaker muscles and worse balance. It just becomes a vicious cycle. But here's the good news. We are not powerless. There's a lot we can do starting today to stay strong, stay balanced, and stay safe. So let me paint a picture for you. Imagine you're doing your usual daily routine, maybe watering the plants, walking the dog, whatever. It's a typical day. But then you miss a step. You fall. Maybe you break a hip. Here's what happens next. You're in the hospital, maybe surgery is required, your recovery is long, and often during that recovery, you're much less mobile. So according to a 2021 study published in JAMA Network Open, only about 30% of older adults who fracture a hip regain their pre-fracture level of independence within a year. That's a major hit to your freedom, your confidence, and your overall health. And hip fractures aren't just physically challenging, they can be life-threatening. In fact, the 1-year mortality rate after a hip fracture can be as high as 20%, especially in adults over the age of 80. Now, I don't say this to scare you. I say it because this is something we can do something about. And here's the truth. As we get older, a couple of things are working against us. Our muscles naturally shrink and weaken. This process is called sarcopenia, and it starts as early as age 30, but it becomes more noticeable after the age of 50. At the same time, our bones are losing density. Especially for women postmenopausal, bone loss can accelerate. That's when we start hearing terms like osteopenia and osteoporosis. And with weaker bones, even a mild fall can result in a fracture. But it's not just about bones, it's about your balance. And there are a lot of reasons our balance gets worse as we age. Loss of muscle strength, changes in vision, slower reaction times, inner ear issues, and side effects of different medications. And here's one you might not think about: our feet. Yeah, those hardworking, often neglected feet of ours play a huge role in your balance. If they're weak, stiff, or if we have foot pain, it can throw everything off. So with all of that going on, less muscle, less bone density, slower reflexes, it's no wonder falls become more common. But again, that's not where the story ends, so let's flip the script. Imagine the same person, same age, but this time they've been doing a few things differently. They've been strengthening their legs and feet, doing some balance exercises a few times a week, checking in with their doctor about bone health. They've had their vitamin D levels tested, they're using a nightlight in the bathroom and wearing shoes with good grip. That same misstep, maybe they don't fall, maybe they catch themselves, or if they do fall, their bones are stronger and they don't break anything. That's the power of preventive health. It's not just about adding years to your life, it's about adding life to your years. And to be honest, it doesn't take a ton of time or money. We're going to talk about simple exercises you can do at home, and we'll talk about what foods help build bone strength, and I'll walk you through what to ask your doctor the next time you go in, because knowledge is power and movement is medicine. So let me propose something. Fall prevention is not just about avoiding injury. It's about protecting your independence. It's about being able to keep doing the things you love, like gardening, hiking, dancing, or playing with grandkids for as long as possible. Now, we just discussed how common and dangerous falls can be as we get older, but we also talked about hope and prevention. And now we're going to dig into the first most powerful step you can take to stay upright and independent: strengthening your legs and feet. Now, let me say this very clearly. Strong legs save lives. That might sound a bit dramatic, but the data backs it up. Research shows that older adults with higher lower body strength are significantly less likely to fall than their peers with weaker leg muscles. One large study published in the Journal of Gerontology found that poor lower limb strength was one of the strongest predictors of future falls in older adults. And your feet? Yeah, they're the unsung heroes. Weak or stiff feet make it harder to react, balance, or catch yourself when you trip. So today we're giving your feet and legs the attention they deserve. But first, let's understand what's really going on. So starting in our 30s and 40s, we begin to lose muscle mass. And by age 50, that loss picks up speed. This condition is called sarcopenia, and it can reduce muscle strength by as much as 3 to 5% per decade after the age of 50. So by the time we hit 70 or 80, it could be more than 30% muscle loss if we're not actively working to maintain it. But here's the empowering part. Strength training can reverse or slow this process. According to the National Institute on Aging, even people in their 80s and 90s can gain muscle mass and strength through resistance training. So let's literally start at the bottom. We often take our feet for granted, but they contain 26 bones, 33 joints, and more than 100 muscles, tendons, and ligaments. They support your entire body and help you balance, shift weight, and absorb shock. When those muscles weaken or your ankles get stiff, your balance suffers. So what can you do? So here's a few easy foot and ankle exercises you can do while you're watching TV, standing in the kitchen, or even just brushing your teeth. The first exercise is toe lifts. So you're standing, you're going to just lift your toes off the floor while keeping your heels and the balls of your feet planted, hold it for 5 seconds, and lower it down. Repeat that 10 to 15 times. Now, I would definitely recommend that you hold on to a support while you do that. So toe lifts is the number one exercise. Number 2 is heel raises. Still standing in front of your chair or countertop to hold on to. Just raise your heels up, hold for a couple seconds, and lower them down. Again, repeating 10 to 15 times, a couple times a day. And those heel raises are going to work your calf muscles and your ankle stability, which is crucial for walking and stair climbing. The third exercise you can do are called ankle circles. While you're sitting on the couch or lying in bed even, you can lift one foot slightly up and start to draw circles with your toes. I always imagine drawing a big letter O in the air with my toes. You're going to do a few in one direction and then a few in the other, and then you're going to switch to the other side. Ankle mobility is a huge part of your balance system. If your ankles are stiff, your body can't adapt quickly when you trip or stumble. And so now let's move up to your legs. And you don't need heavy weights, fancy machines, or even a gym membership to strengthen your legs. You can do things at home. The first exercise is called sit to stand. So you sit in a chair, and then you just cross your arms over your chest if you can, and then you slowly stand up and sit back down. So this is basically rising and sitting again without using your arms to strengthen your quads, your glutes, and your hamstrings. The biggest muscles basically responsible for standing and walking. The second exercise is wall squats. You stand with your back to the wall, feet hip width apart, and you lower down into a gentle squat. Not too deep. You hold for 5 to 10 seconds, and then you come back up. The third one, side leg lifts, which targets the side of your legs. You're holding on to a chair or countertop for support. You shift your weight to one foot and then lift the other leg out to the side, and then you lower it down 10 to 15 times per side, and then you're going to switch. So this again is working the side of your legs, which helps to stabilize your pelvis and keeps you from swaying or losing your balance. But here's the key. Consistency beats intensity. You don't need to train like an athlete, but you need to show up regularly. Say 10 minutes every day. The World Health Organization recommends that adults age 65 and over do muscle strengthening activities at least 2 days per week, in addition to balance enhancing exercises. So even just 10 to 15 minutes a day of targeted movement, like the ones I described earlier, can improve your strength, your mobility, and your confidence. And the best part, you'll start noticing changes pretty quickly. So what's your next small step? Pick one of these exercises, just one, add it to your daily routine. Maybe while you brush your teeth, or personally, I like to do it while I'm waiting for the tea kettle to boil. Strength builds over time, just like confidence. So now let's talk about training that you can do specifically for your balance, how to improve your coordination, prevent stumbles, and actually retrain your brain to keep you steady. So here's the thing, balance is not just about your legs or your muscles, it's a full body system, a full body skill, which involves muscles, eyes, inner ear, and brain. All of those systems work together every time you stand, turn, reach, or just look over your shoulder. And the good news, you can train your balance just like you train your muscles. So let's talk a moment about why balance tends to decline as we age. As we get older, we experience what doctors call multisensory degradation, a fancy term that means a lot of your body's sensors, like vision, proprioception, which tells your body where your limbs are in space, and inner ear function start to lose precision. Add in the slower reflexes and weaker muscles, and suddenly your body isn't as good at keeping itself upright when you trip, turn, or get bumped. But, and you knew this was coming, right? You can improve it. Studies show that balance training can significantly reduce the risk of falls in older adults. So let's talk about how to do that. So the goal is to challenge your balance safely in ways that engage the muscles, nerves, and reflexes that keep you stable. And you don't need special equipment, just a sturdy chair or countertop for support. So your first exercise is called a single leg stance. You're standing behind a chair or near a wall holding on for support. You're going to lift one leg off the floor and balance on the other for up to 30 seconds. And then you switch legs. Pretty easy, right? If you master that, do it again, but try closing your eyes. Again, still holding on to the support. And why does this one work? Well, it improves ankle and hip stability, and it forces your brain to adapt to small shifts in weight. So the second exercise you can try is called a tandem stance. Now this is like a heel to toe position. So you're standing with one foot directly in front of the other. So your heel is touching your toe. You hold this position for 10 to up to 30 seconds, and then you switch sides. And then you can progress by try walking in a tandem position, heel to toe, for 10 steps. So this works because it mimics narrow walking situations like crossing a curb or stepping into a bus. So the third exercise is weight shifting. Basically, you stand with your feet hip width apart, and you're just shifting your weight to your right leg while lifting the left foot just slightly off the floor, holding for a second, and then shifting over to the other side, holding for a second or two. And again, you're going to keep repeating this. Now this works because it mimics everyday movements like reaching sideways or turning. So balance is a neuromuscular skill. It's not just physical, it's mental as well. Your brain has to make quick decisions based on what your body is sensing. So here's what's amazing. When you do balance training regularly, you're not just strengthening muscles, you're reprogramming your brain to respond faster and more effectively to stumbles, slips, and even uneven walking surfaces. There's even a name for this, neuroplasticity. It's your brain's ability to adapt and learn new movement patterns. And yes, it still works in your 60s, 70s, and beyond. If you're interested more about brain health, tune into one of my earlier podcast episodes where I talk specifically about brain health and neuroplasticity. So what's the key takeaway here? The key takeaway is that balance is not a fixed trait. It's a skill you can practice, strengthen, and improve just like any other. And start small. A minute or two every day will make a difference. Maybe while you're waiting for your coffee to brew or brushing your teeth, The key is consistency. And always make sure you're safe. So have a chair, wall, or countertop nearby to support you so that you feel confident doing those exercises. With those exercises, I will be posting a Facebook video in case you want a little visual support to walk you through some of those. So next, let's talk about bone health, why your bones matter so much when it comes to fall recovery, and how to strengthen them from the inside out with smart nutrition, supplements, and medical checkups. Now, I want you to imagine this. 2 people trip and fall. Same situation, same stumble. One person gets up, maybe they're a little shaken, but they're okay. The other ends up in the hospital with a broken hip. So what's the difference? It might be their bones, right? The bones are living tissue. They're constantly being broken down and rebuilt in a process called remodeling. In our younger years, we built more bone than we lost. But after around age 30, that starts to shift. And by the time we reach 50 and beyond, bone loss starts to accelerate. So for women, bone loss becomes especially steep after menopause due to the drop in estrogen. In fact, women can lose up to 20% of their bone density in the 5 to 7 years after menopause. Men aren't off the hook though either. By age 70, both men and women faced increased risk for osteopenia and osteoporosis. Both are conditions that make bones brittle and more likely to break. So let's just take a pause here. More than 10 million Americans have osteoporosis, and another 43 million have low bone mass, putting them at risk. And the kicker is that many people don't even know it until they suffer a fracture. So let me be loud and clear. Healthy bones can mean the difference between a stumble and a serious injury. Now, I know this isn't fun to hear, but it is really important. So according to the CDC, over 300,000 people aged 65 and older are hospitalized for hip fractures each year in the US. And most of these fractures are caused by falls. And sadly, the outcomes can be serious. Studies show that 20 to 30% of older adults die within a year of a hip fracture due to complications like immobility, infections, or surgery-related issues. And even for those who survive, about half never return to their previous level of independence. So if you're over age 50, especially if you're a woman, talk to your doctor about getting a DEXA scan. It's painless, low radiation test that checks your bone density, usually at your hip and spine. Your doctor will help you interpret the results and decide what steps you need to take next. Might be a lifestyle change, supplements, or even medications. So how can you feed your bones right? Your bones are constantly rebuilding themselves, but they need the right materials to do it. So here's what helps. Calcium. We've all heard this one. It's no surprise, right? Calcium is the main mineral in your bones. And good food sources include dairy products like milk, yogurt, and cheese, fortified plant milks, leafy greens like kale and collards, almonds, and tofu. But if you're not getting enough from food, your doctor might recommend a calcium supplement, so talk to your doctor. Vitamin D is also important for bone health. It helps your body absorb calcium, and without it, all that dietary calcium doesn't do you much good. And many adults are at high risk for deficiency, especially if you live in northern climates or don't get much sun exposure. You can ask your doctor about a blood test to check your vitamin D levels. And if you're low, a supplement might be needed. But vitamin D also helps with muscle strength, which reduces fall risk. So the third component that's really important for bone health is protein. It's not just for muscles, it's also important to build strong bones. So your doctor will tell you what the recommended dosing is per kilogram of body weight. If you're over the age of 65, especially if you're working on strength training, it might be a little bit higher even. So talk to your doctor about what is the recommended amount of protein you should be consuming every day. But good food sources include eggs, fish, poultry, legumes, dairy, and soy. So now the third step here, load your bones. Bones respond to stress. Physical stress, meaning weight-bearing resistance exercises. So when you apply healthy pressure to your bones, like walking, lifting weights, or climbing stairs, your bones respond by becoming stronger and denser. In fact, a study published in Osteoporosis International found that postmenopausal women who did resistance and impact training increased bone density at the spine and hips after just 12 months. So here's a few bone boosting activities: walking, hiking, dancing, resistance band exercises, bodyweight moves like squats and lunges, or stair climbing. Now, swimming and biking are great for your cardiovascular health, but they don't count as weight bearing, so they're not going to help to build your bone strength. So make sure you include some upright load bearing activities too. Now, there's a few steps to avoid when you're trying to build your bones. There's specifically some lifestyle choices that can weaken your bones, which include smoking, excess alcohol, very low calorie diets, and sedentary behavior. So if you're not sure where to start or feeling a little overwhelmed, talk to your doctor or a registered dietitian. They can help you figure out what your bones need based on your unique situation. So let's just recap. Bone health might be silent. You can't feel your bones getting weaker, but the impact of strong bones is loud and clear. They protect you, they support you, and they help you bounce back from the unexpected. But don't wait until you break something to take action. Be proactive. Get your bones checked. Eat well, move often, and remember, even small daily habits like a walk around the block or a yogurt with breakfast can help build a stronger foundation. So how do we put it all together? How do we create a daily routine that includes strength, balance, and bone support, and how to stay motivated along the way? So let's just create a simple, clear action plan to help you stay steady, strong, and safe. Because here's the truth. You have more power than you think. Even small, consistent changes can make a huge difference in your mobility, your independence, and your overall quality of life. So first of all, strengthen your muscles. We already discussed exercises for the legs and feet, the foundation of your stability. Well, why? Because strong legs mean better balance, faster reaction, and more confidence when you move. So try some of the exercises suggested. Just 10 minutes a day is a great start. And as you build strength, you build confidence. And personally, I always have an exercise snack when I'm waiting for my tea kettle to boil or the pasta water to boil. I might do something like the heel raises or squats to use the time wisely. And if you don't know what an exercise snack is, go back and listen to one of my earlier podcasts where I talk about them. Also, train your balance. Now, balance isn't just something you lose with age, it's something you can retrain. So again, practice some of those exercises we talked about earlier. And remember, safety first. Always hold on to a support. And the more you challenge your balance in small ways, the better your body gets at staying upright. Support your bones. Your bones are like your internal armor. Strong bones can protect you even if you fall. So make sure to talk to your doctor, get a DEXA scan to test your bones. Eat calcium-rich foods. Have your vitamin D levels checked. Include weight-bearing activity every week. And avoid the bone drainers like smoking and excess alcohol. Strong bones don't just help you recover better, they help you resist injury in the first place. So please talk to your doctor. Don't skip this step. Your doctor can order that bone density scan, the DEXA. He can recommend safe exercises if you have joint pain or any other health issue. He can have your vitamin D and calcium levels checked and help you decide whether medications might be appropriate in your unique situation. So it's a team effort, your doctor, your body, and your commitment all working together. Finally, stay consistent, not perfect. Look, I know it's tempting to want to overhaul everything at once, but the secret to real lasting change is consistency, not perfection. So start with one thing, maybe a 5-minute walk, a daily balance exercise, adding yogurt, or scheduling your doctor's appointment. And then build from there because momentum is powerful. And remember, progress doesn't always show up overnight, but if you stay consistent, it will show up. And before we wrap up, let me just leave you with this. Falls are common, yes, but they're not inevitable. And losing strength or mobility with age, that's not written in stone either. You have the ability right now to build a safer, steadier, stronger future, one choice, one habit, one small step at a time. You deserve to move with confidence, to feel grounded in your body, and to walk into your later years not with fear, but with strength and grace. And I'm here cheering you on every step of the way. So if you found this episode helpful, I'd love it if you shared it with someone who needs a little encouragement. And don't forget to subscribe, because we'll keep exploring all kinds of health topics for adults 50 and up, from movement and mindset to nutrition, sleep, and everything in between. So until next time, stay safe, stay strong, and remember, your health is your power. And if you want to check out the video of the suggested exercises, please go to my Facebook page called Deliberate Aging. Thanks for listening. This is Dodie from Deliberate Aging. Until next time, be well, friends. This podcast is presented solely for informational and educational purposes only. Use of information from this podcast is at the user's own risk. It is not intended as a substitute for the advice of your physician or other qualified professional. We are not responsible for any losses, damages, or liabilities that may arise from use of this podcast.